This podcast and content posted by Dr. Judith Joseph is presented solely for general informational, educational, and entertainment purposes. The use of information on this podcast or materials linked from this podcast or website is at the user's own risk. It is not intended as a substitute for the advice of a physician, professional coach, psychotherapist, or other qualified professional diagnoses or treatment. Users should not disregard or delay in obtaining medical advice for any medical or mental health condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Dr. Christine Crawford is an adult, child, and adolescent psychiatrist who serves as the Associate Medical Director for NAMI, the National Alliance on Mental Illness, the largest grassroots mental health organization. There is one place families can go to where you know it is a vetted resource, you know it's trusted, and the fact that NAMI has been around for so long. She is the author of the book, You Are Not Alone, for Parents and Caregivers, the NAMI Guide to Navigating Your Child's Mental Health. Dr. Crawford joins us on the Vault to provide guidance on how to support families and youth with mental health issues. She discusses a step-by-step plan that families can utilize to help them navigate a challenging healthcare system.
The top 3 things is that mental health symptoms can appear in young kids. There's oftentimes this belief that symptoms of depression, anxiety, PTSD symptoms typically just emerge in older kids, whether that be middle school age kids, high school kids, teenagers. But the truth of the matter is that we're seeing the manifestations of mental health symptoms appear in the preschool years, appear around age 5.
Dr. Crawford also serves as the Vice Chair of Education in the Department of Psychiatry at Boston University School of Medicine, and she has a specialty in treating childhood psychosis and other pediatric psychiatry emergencies. In a world where parents often have to Google to find answers, Dr. Crawford has worked with NAMI to create a guidebook that provides a comprehensive and clear plan for childhood mental health. Dr. Crawford, I'm so excited to have you in the vault today.
So excited to be here. Thank you.
And a lot of people don't know about NAMI, and as a psychiatrist, it's surprising to me every time I tell someone about NAMI and they're like, what is that? But please tell us about NAMI and your role there.
So NAMI is the country's largest grassroots organization that's dedicated to supporting the emotional well-being of people who are living with mental health conditions, as well as their friends and family members. So we have chapters all across the country that put together different support groups, educational workshops, and so there is a local NAMI in each and every state. So I hope that people can reach out to NAMI as an amazing support, but also our website, NAMI.org, has a lot of information about different mental health conditions as well as treatment. And I have the pleasure of being the Associate Medical Director for NAMI, so I'm one of 2 psychiatrists that's a part of this organization. And so I love to just raise awareness about mental health issues just so that the general community has all the tools that they need in order to take care of their own mental health.
You know, it's so great that you brought up families, because when we think about mental health, at least when most people think about mental health, they're thinking about one person, you know, the identified patient, the individual. But that saying, it takes a village, is so true. And, you know, I don't think that people know that there are so many resources for caregivers, for parents, that you don't have to do this alone. And I remember a couple of years ago, I had a family that I was working with, and I think that the mom got the most out of the peer support that she got from a NAMI group than from any other treatment that she had been in with her kids. So what does that look like for somebody who is listening to this? What does it look like to get support from a peer group? Because many people, they don't want to put their business in the streets. They don't want to put their business out there. But what does it really look like when someone's going through this as a parent or a caregiver?
Yeah, when you are able to tap into a community of lived experience, other families that have gone through this and walked this journey, it gives you a sense of hope and encouragement that you can too navigate this journey that seems impossible at the beginning. Also, people feel like they're starting from scratch when it comes to understanding mental health conditions and understanding what resources they should tap into. But when you're able to connect with a community like NAMI, there's already a playbook that can be shared with you about how to approach this journey without feeling like you're alone, having to search on the internet and assembling a team of your own support. Talking to someone else about how they navigated this journey is incredibly helpful. But also there's the emotional experience of knowing someone and then seeing a change in their emotional state and their behavior, and noticing a change in your relationship with that individual and how difficult that must be. You want to be supportive to that loved one who's experiencing mental health issues, but you're also trying to figure out how to support yourself in light of all of these changes in this person that you know. And talking to people in support groups through NAMI who have gone through something similar, you feel validated in your experience. You don't feel as shameful about having these thoughts about your loved one who's navigating this journey. And it's hard to talk about these things with other people who have not been on this journey. And so having that connection with other people with lived experience, having that support, that validation, makes it such that you are a better loved one and family member for the person who's experiencing those mental health challenges, because you have the support that you need in order to best support that loved one.
And there are so many resources out there. There's so much information out there. Sometimes it's just overwhelming. And so when I saw you post about this book, or someone in your team post about it, I was like, yes, finally, there is one place families can go to where you know it is a vetted resource, you know it's trusted. And the fact that NAMI has been around for so long, that there are so many families who have been supported, who've had experiences with NAMI, that's just this next level expertise that, you know, people have access to. So tell us about this book and how it came to fruition.
Yeah, as a child and adolescent psychiatrist, I have such limited time in my clinic schedule to connect with families, to connect with kids and adults who are experiencing mental health challenges, and to pack everything into a 30-minute visit or a 1-hour evaluation, it feels impossible. And a lot of people, when they think about mental health issues, they just think about the diagnosis and the treatment. And that's something that I am trained to provide. But what people often feel is lacking during some of those clinical encounters with me is, what do I do once I leave this office? What do I do outside of therapy appointments? There's so many other hours of the day in which I'm with this child who's experiencing these difficulties. What do I do? And so I've realized, and I've learned along the way, that treatment is one part of the puzzle, one piece of the overall picture when it comes to supporting a kid with a mental health issue. It's about, how do we support them as a family? How do we change our family dynamics in order to best support their emotional needs? How do we think about our conversations with the school and how it is they're connecting with their school-based community? There have been so many questions that have come up during my clinical encounters that aren't based about medications and treatment. It's about, how do I talk to my kid and how do I be present with my kid given all of these challenges? So what I decided to do is I decided to interview over 80 people, including kids, young adults, teachers, coaches, and other people who are invested in the mental health of young people, to learn from them what are the key pieces of information that other people who are starting this journey or are already on this journey, what do they need to know in order to help guide them on this journey and to give them the encouragement to keep going. Because that is a set of expertise that is so valuable, the expertise of those with lived experience, that I wanted to really tap into to support people's understanding about what life can look like supporting your kid outside of visits with me. And also, writing this book allowed me to put all that information around communication, connection, caregivers understanding their own role in their child's emotional well-being, thinking about their own mental health and how that is factoring in to how the kid is manifesting their own mental health related challenges. It's hard to pack all that into a clinical visit. So that's why I was really happy to have this opportunity to put all that information in this book, along with all of the information that I learned from the over 80 people that I interviewed over 2 years. So I love that this is a resource that not only talks about how to talk to your kid and how to understand mental health conditions, but how to understand how some of the mental health symptoms manifest in kids from as young as 3 all the way up to 18. And to have one book available that covers it, because what we know about kids is that they change over time. They mature, they develop. So depression can look different in a 6-year-old than it does in a 17-year-old. But to know that you can have this book and you can reference this book and go back to this book across, your child's development is really meaningful. And also not labeling your kid as having a specific diagnosis or a specific problem, but understanding kind of buckets of ways in which kids express their problems is something that I also touch upon. So I'm really excited to have this comprehensive resource available for people so that they don't have to buy 15 different books that are based on different diagnoses that we don't even know if the kid has. And if they have right now, it could change over time.
And it sounds like your book is very much into the biopsychosocial model, which you and I know because in training, we learn about this from the time we're students. But what I found to be very powerful is that when I'm sitting down with a family member or a patient or client, I'll ask them to write their own biopsychosocial. And what this does for them is that it allows them to see themselves in different ways. For example, you mentioned like sometimes it's not just about a medication, right? Maybe that's just like the 10% of the treatment and the real meat of the treatment is everywhere else, right? So with your biopsychosocial, the biology, that's just one part of it. But the social sometimes is really where the heart of the treatment is, because we've seen it. When you take a child out of an environment, they suddenly get better. Even with very little intervention, they get better. So in some cases, that social situation is where we need to put a lot of our efforts. And it sounds like you're really trying to allow families to see, okay, there are many ways to approach these issues. There are many ways to think about it. Let's try and focus on things that we have agency in, that we can change so that we feel hope. And I think hope is something a lot of parents have lost. We recently heard that the Surgeon General reported that parenting is now a hazard. And I was like, you know what? How validating is that? That, okay, the Surgeon General says it because we're all feeling it, right? We're all feeling it as parents, as providers, as professionals. And finally, someone puts a label to it. And, these labels are interesting because they're meant to bring about attention. But I think it's about time that we acknowledge that parents need help and not everyone has access to one-on-one professional help. So books like yours it's so crucial. And there's a chapter in the book that, it caught my eye immediately. It talks about the children who are a bit more challenging, and you had mentioned like, we're so quick to put labels on people and so forth, but the reality is that some children are just a bit more challenging. Some children are a bit, more disruptive in their behaviors. But what are some of the tools that you've written about or that you recommend when you think you're at home dealing with a child that is a bit more challenging?
Yeah, and it can feel difficult because for a lot of these parents, they've tried everything, they tried everything that they're aware of, right? They've tapped into all the tools that they know about. But there's so many tools that a lot of people don't have an opportunity to be exposed to. And especially if you grew up not having had certain mental health supports in place for yourself, you don't really know what the full scope of what is out there that could be available for both you and your kid, not only in clinical spaces, but also inside of the schools, in the communities. And a lot of people forget to tap into those valuable resources. A lot of parents feel like they either got to figure out how to solve the problem on their own, or they bring the kid into seeing someone like us, a mental health provider, and that mental health provider will solve the problem. My kid has a problem, you've identified the problem, and mental health clinician, you solve the problem, and that's it. And that kind of takes off a sense of ownership off of the parent for helping to better support their kid who might be challenging. Because they're like, I already did what I could do. I brought them to this appointment. Now you take over, right? But it's important for caregivers and parents to still remain in a empowered position and to feel like there are still tools that they can utilize to help support their kids. So what does that actually look like? So when we see a kid, what we can do for our caregivers is that we're better understanding the kid that's sitting right in front of us in the context of their whole entire life, right? And so kids exist in a variety of different systems. They exist within the family unit, that system, within the school system, within the community unit and community system. And so we talk about all of those things. And then we talk about the parent's role or the caregiver's role in supporting that kid and navigating these systems, right? And so a lot of people forget that when it comes to the schools, there are things that parents can actually do to advocate for their kid who might be challenging, to advocate for the kid who's challenging, and people have already written off. Oh, they're too disruptive. We tried everything, right? And so talking to a mental health provider who can guide you, empower you with a set of tools that you can use to continue to advocate for your kid so that you don't feel hopeless, that you don't feel like you've run out of options. And that's one of the powerful things of connecting with someone in the clinical space is about just getting those tools and feeling like, okay, I can continue to do things. Also, when you are following up with the schools about how your kid is performing academically and socially, when you're following up with their therapist, you're a very important person because you're basically, I describe kind of talking about like a coach, you know, like a team manager of sorts, right? You're like, this is the kid, and I'm kind of organizing all these different people who are supporting my kid. What are you guys doing? Here's what I can report back about some of the changes that I've noticed since being involved in treatment, since these changes have been implemented in school. And just being in the position of noticing your kid and reporting back, that's also an empowering position to be in because you can do something. You're actually collecting information and data about what's working and what's not working. So even though the kid right in front of you might be challenging, don't lose hope because there are so many things you can still do for your kid, such as advocating for them, noticing changes in their patterns of behavior in response to treatment, and reporting back to everyone, and changing the different players who are part of the team that's supporting your kid. But it can be hard. It can be hard, Dr. Joseph, because parents are tired. Caregivers are tired because they're dealing with their own stresses, right? So imagine if you are dealing with significant anxiety because living in this world, in this day, can be anxiety provoking, can be really difficult, and dealing with a difficult kid and not feeling like you have the break and support that you need, it's too much. And that's why I keep talking about the importance of leaning into community-based resources and supports. Lean into other people so they can help you so that when you are tired, there's someone else who can chime in, support you, support your kid. There's no way we can do any of this alone.
And there's something powerful about knowing that it is not just you. Because unfortunately, there is a lot of shame. Parents feel like somehow it's their fault. And this could be conscious or unconscious, but when you have a parenting group and you hear that other people have challenges and that you're not the only one, then you don't feel like, oh, wait, it's not me. I'm not a bad parent. Like sometimes things are difficult, right? We talked about the biopsychosocial. There are many reasons why a child may be a bit more difficult than another one to manage. But when you have someone to lean on, that is an infinite resource. And there are times when I have clients and families where they'll say, I went to this parenting group and the other parent said that they advocated for XYZ for their child. And I didn't even know that existed. So I went to the school and I asked for it. And you know what? I got it. It took some time, but I would have never known about it had I not gone to this group. So that is why we need to talk about it. When we talk about these things, we're not just helping others because we're showing them that they're not alone, but we're getting help because we're getting that support and the resources that we otherwise would not have had access to. And in your book, you did talk about different types of conditions. And I think that when many people think about mental health, especially if they've never dealt with, trying to find a therapist or they looking for a provider or a professional, that they think about things like depression or anxiety. But there are so many different things to think about in terms of pediatric and adolescent mental health. And one of the areas that's most often misdiagnosed, misunderstood, is the area of autism and autistic behaviors, because there's so much overlap between OCD and ADHD and learning disabilities and depression. So if you have a parent who's like, well, okay, where do I even begin? I don't know what's going on with my child. What do you advise that they do?
Yeah, I think when it comes to kids who have conditions like autism, what it is a reminder of is that all of our kids have unique brains. And some brains just happen to be a little bit more different than other brains. And I talk about in the book, in the first part of the book, before I even dive into the different mental health presentations, I talk about just understanding your child's brain, understanding how over the course of development, how their brain might have just been wired differently. And so they may be more sensitive to different situations, whether it be social situations, situations that involve learning in the classroom environment. They may be more sensitive when it comes to different sensory-related issues in terms of loud noises, in terms of different textures, just to appreciate these unique differences first, right? Because we're so quick to assuming that every kid's brain should be like the other kids' brains, right? And we're so accustomed to comparing kids to other kids based off of their chronological age. So an 8-year-old should be like all the other 8-year-olds in the classroom. What's going on? What's going on? And when parents and caregivers start to do the comparison based on chronological age, that can produce a lot of anxiety because they think that their kid should be exactly like all other kids. But what I've been encouraged by in recent years is that there's more of a appreciation for neurodiversity and how these aren't necessarily problems, but opportunities to be curious about the ways in which our kids' brains are designed and connected, so that as the kid ages, we could just be a little bit more aware as to how they are behaviorally responding to different things and how are they responding emotionally, and just kind of be on more of a lookout for that, and to appreciate the fact that they just might respond differently to things. So what does that actually look like? So if we have a kid who seems like for the first few years of life, they might have been somewhat delayed in the timing in which they started talking and walking and toileting and doing some of those things that we look at as developmental milestones. And then we're curious about how are they in social environments around kids their age or even around adults? Do they seem interested in wanting to communicate? Do they seem to be responsive and receptive to different forms of communication, whether it's verbal or nonverbal? And do they happen to have some restricted, limited, repetitive interests that are quite notable? And once we're able to identify those things early on, it allows us to put certain supports in place, to put them in early intervention or other forms of therapy, so that as they continue to advance in age and emotionally they start to develop, they have a little bit more tools to help them better navigate some of these challenges. So there are kids who, with early intervention, who have an autism diagnosis can grow up to appear and look like neurotypical kids because they had all of those robust supports in place. But a lot of parents oftentimes don't know about some of the signs and symptoms or in denial, and they keep delaying. They're like, no, we don't need this. They're 5. We don't need this. They're 8. We don't need this. They're fine. They're just like everyone. And then they're 10. And then we start to see problems. But what I'm really hoping that people can learn from this book is that there's so much that we can do by investing all of our time and resources early on in the kid's life, so we can make it such that they're not going to develop a crisis, such that they're not going to have significant symptoms of anxiety that get in the way of their ability to function, that they won't have levels of depression that make it such that they no longer want to live. And so I hope that people reading this book who appreciate how different brains are set up differently will be a little bit more intentional in getting those necessary supports in place now, so that we don't have kids who have neurodevelopmental issues who are struggling. They're struggling to navigate a really confusing world without the supports. We don't want that for kids. So I hope that folks can take away that key message from this book as well.
And it's about inclusivity as well. If people don't know that these are symptoms, these are potential ways that people express certain conditions. If we don't know, many times people are just, they get excluded. So it's important from an inclusivity point of view so that there is acceptance, not just awareness. What are let's say top 3 things that you think maybe people don't know a lot about, but you have that insight because you're positioned within NAMI, and tell us about those 3 things.
So the top 3 things is that mental health symptoms can appear in young kids. There's oftentimes this belief that symptoms of depression, anxiety, PTSD symptoms typically just emerge in older kids, whether that be middle school age kids, high school kids, teenagers. But the truth of the matter is that we're seeing the manifestations of mental health symptoms appear in the preschool years, appear around age 5. The second thing that I want people to know is that mental health conditions, for some, can be life-threatening conditions. I think when people imagine mental health conditions in kids and teenagers, they're just thinking about kids who can't cope. They're thinking about parents who aren't doing the right things to make it such that their kids are effective at managing intense emotions. But that's actually not the case. What we see is that there are kids as young as 5 years old who are contemplating suicide. And for a lot of people, it's hard for them to wrap their minds around the idea that a kid in kindergarten would want to resort to that as a way to deal with symptoms of depression. And yes, 5-year-olds can experience depression, but that is a really important thing that I want all adults to know, that this can be very serious for a lot of young kids, and even more serious if we don't do something about it. If we just sit and wait for the kid to figure it out on their own, then that's not going to happen. And then the third thing is that parents and all adults have a shared sense of responsibility in the mental health of all young kids, because we are modeling each and every day for how to deal with stress and intense emotions. And our kids are noticing us, even though we may not always notice them, and we should be noticing them, but they notice us, right? They notice changes in how we're talking, how we're behaving. But we need to make sure that we are consistently modeling and intentionally modeling how to manage our mental health and how to support our mental health. Because people assume that kids just learn how to take care of their social emotional well-being. They just figure it out. But we're not like that when it comes to safety in other regards. When it comes to physical safety, we're very intentional about teaching about that, about how to recognize some medical conditions, how to take care of yourself if you're in a car and put on your seatbelt. But we're not as intentional about talking about how to take care of your mental health. And we have to be, because if we don't, lives are at stake. Lives can be put at risk because, as I mentioned in point 2, these are serious life-threatening conditions for some. So we really need to be intentional about providing our kids with the tools and skills that they need, not only in childhood, but in their teenage years, but for their adult lives too, so that they can thrive and be on a trajectory that we had hoped they would be on from when they were little kids, you know?
Yeah, I'm glad you brought up that things can be very, very serious with regards to mental health. I just interviewed Dr. Tia Dole, and she oversees the 988 Lifeline, the suicide hotline. And she said she dropped these nuggets that I was just like, wow, every parent should hear this. And she talked about protective factors. Protective factors for girls was having dinner with their family every night and playing a team sport. Protective factors for LGBTQ plus youth is having at least one parent, one attachment figure accept them, like radically accept them. And then she talked about boys, how there's a rising rate of young Black boys having worsening suicide, and how, you know, we need to stop talking to our boys differently than we talk to girls. We need to be very protective with them. We need to warn them in the same way we warn our girls about safety issues. And, right on the discussion about protective factors, what are some other protective factors that all parents should really be thinking about, because they all can do this? What do you recommend?
So what I recommend is we really need to prioritize connection when it comes to our kids. You know, building off of what it is that you had just described as protective factors, you know, having dinner with your kid. It's really about connection. And I feel like a lot of parents and caregivers are disconnected due to a variety of reasons, because life is very complicated. And because of this lack of connection to the kid in front of them, they don't necessarily notice changes in the kid's behavior and their emotional state. So in the book, I talk a lot about look, listen, and lock in. You know, being fully present and looking for these moments to connect with your kid will allow you to better understand a pattern in your kid's behavior and their emotional state. And I think because people are so disconnected, they don't even know what the pattern is in their kids. You know, everyone's off on their phones, or everyone's having dinners in their separate places. A lot of people don't really know their kids. And I hear that time in and time out. And so I think that not only noticing your kid through connection, but being curious about your kid while you're attempting to connect with them, right? To be curious about what their life is like. What are some of the things that they think about? What are some of the things that they're looking up on social media about? What are some of the things that their friends are talking about? Just understanding the world of your child by asking questions out of a place of curiosity. I think that as parents, we tend to talk at our kids, being like, don't do this, you shouldn't do that, why are you doing this? Rather than being curious about why it is they're doing this, to be curious about what it is they're looking at their phone about. But we're approaching it a little bit differently, and I think because we just don't have time and we just want to kind of get to the root of things. When we're understanding our kids, connecting with our kids, and we're being curious with our kids, number one, they're not feeling lonely, because they feel like there's someone who's actually noticing them, who cares about them, and we're communicating that to them. We also are able to plant the seed that we're willing to talk about their mental health. A lot of parents say to me, oh, I tried to have a conversation with my teenager, but they ignored me. They said everything was fine, I'm fine, get out of here, I'm fine. You keep at it, right? Because you are planting the seed in every interaction you have, talking about being curious about the kid's day, what it is they're going through. You're watering that seed. You're watering it with every single interaction. So you're actually doing something, even if they're closing the door in your face. And then there could be this moment, it could be days, weeks, or even months later, where finally they approach you with a challenge, a change in their behavior, a change in how they're feeling, but you have already signaled and communicated to them that you're interested and you want to talk about their mental health. And so you're primed and ready to go. And so a lot of caregivers need to know that you may not be able to form that connection right away, especially if this is a new thing, you having conversations about mental health and you're kind of starting it, later on in life, but to keep at it because it will pay off dividends. Because we want kids to feel connected to the adults in their lives, because we want them to come to us to help them problem solve, rather than them going to social media and Googling something or other and they're problem solving with a 14-year-old about how to address this mental health concern. Like, I'd rather them come to mommy Susie Q in Nebraska rather than Sam in South Dakota who's 12, right? Who's posting videos. So I just tell parents to keep at it, but it's really about prioritizing connection above all else, above problem solving and blaming.
Absolutely. Look, listen, lock in. A baby, this is what they do for survival. If you ever observe a baby and the way that they interact with their mother or caretaker, they follow that caretaker across the room. They're looking. They're listening for that voice. When they hear that voice, they change their behavior. They lock in because babies understand that attachment is survival. But somewhere along the way, as parents, when they become resilient, they can survive on their own, we stop looking, listening, and locking in. But what many parents don't know is that biochemistry, that biology, that attachment is still there. When your child enters the room and they see you on an unconscious level and on a physiological level, their body's changing because you're there. So I think when parents understand how crucial they are, just their presence in their child's life, no matter what the relationship is at this state, you showing up and being there and being persistent and saying, I am here for you and I am ready and waiting for you, that is powerful. So do not underestimate that. You don't need a provider for that. You don't need a doctor for that. You don't need a fancy education for that. You need to show up for your kid because they're looking, they're listening, and they're willing to lock in. You just have to sometimes put in a bit more effort. I always ask my experts. I always ask my experts about a time in their lives, and like yourself, they're exceptional and they're at the top of their game. And I asked them, what was a time when you on the outside were so put together and people were like, they have it all figured out. I want to be like them. How do they do it all? But you knew that on the inside you were struggling. And how did you get through that?
Girl, I'm going through that right now. Oh my goodness. This question really gets at my core. Oh my gosh. I am going through it and my roots are showing that, I think I love that you asked your guest this question, because we oftentimes make assumptions about the people that we encounter in our lives, but we're only seeing one version of that person in that moment of time. But yet we're projecting all of these thoughts and impressions, all these assumptions on that individual. And when we do that, we're kind of wondering to ourselves, why can't I be like them? Like, they got all these things going on. Why can't I do that? And so it's really important that we normalize these sort of conversations about disclosing when you don't have it all together, when things have been challenging for you, so that other people can know, all right, if all of these other people are faced with challenging moments, then I'm not alone in that. And the whole kind of premise of this whole conversation is that nobody's alone in any of these mental health struggles that they might be going through. So what I have tried to lean into in recent weeks, because it has been really hectic. I have a 3 and a 4-year-old. I am seeing patients at Boston Medical Center. I'm also teaching medical students at Boston University School of Medicine, trying to get more med students interested in the field of psychiatry. I'm really excited about these opportunities to talk about this book and to make it such that as many people can get their hands on this. But I am tired. I am very tired because my kids are waking up in the middle of the night and they're doing that fun thing where they're just climbing in bed with you at 1 o'clock in the morning. Somehow they're able to fall back asleep, but I seem to not be able to do that, right? And so even though I use humor, I smile a lot, I laugh a lot, that's only kind of the mask that I'm putting on right now as a survival technique, right? Because when people ask me, Christine, how are you really doing? It really gets at me because it's really tough. It's really tough. But I noticed that I kind of put on this mask of, oh, yeah, so I can just survive and get through the day. So what I've actually have been doing more of is letting people know that I need help. Letting people know, actually, I can't get to it. Actually, I had said yes, but I can't get it done. I thought I could. I'm sorry. No. So I've been getting into the habit of saying sorry a lot and backing out of things. But the next kind of phase is me not apologizing for having to set up boundaries. So phase one is being like, I can't do it. I need help. But I hope I get to the next phase of just setting up boundaries and saying no from the jump and not having to apologize for putting boundaries in place. So boundaries is what I'm trying to get better at, but also being honest and vulnerable about how I'm actually doing rather than putting a smile on my face when I'm out and about in public.
A lot of people who are very high functioning, and this is the topic of my work, they do feel guilty when they say no. But you know what? Over time, that guilt goes away. And I'm so glad that you said that you ask for help, that you tell people what's happening, because many people, they don't think about us in the mental health field as having problems, but no, we are human. And in many ways, it makes us better at what we do when we can relate to the struggles and to the experiences. Where can we find you? Where can we follow you? And where can we purchase your book?
Thanks for that. So I recommend that everyone go to youarenotalonebook.org, and you can learn about all the different links where you can purchase the book. It's available on Amazon, Target, and Barnes & Nobles. But also on that website, you can see some of the people that I interviewed for this book, and there are sample stories of the people that I interviewed. So I recommend that everyone checks out youarenotalonebook.org. You can also follow me on Instagram at Dr. Christine Crawford and on LinkedIn as well. And so I also recommend that people check out NAMI, NAMI.org. So that's NAMI.org. And you'll have access to a tremendous amount of resources about mental health treatments, as well as our support groups that are available across the country. So certainly reach out. And I hope that the information that you're able to gain from social media, through NAMI Communicate as well on Instagram, I hope that you'll find it to be helpful, encouraging, and empowering, and to kind of tap into a new community that is myself and NAMI.
I truly believe this book will save lives. Thank you so much for coming into the vault and discussing this powerful book.
Thanks for having me. Thank you so much.